Hello, everyone. Thanks so much for joining us here today. This is the first in a series of virtual fireside chats that Health Tech Build will be hosting in the coming months. And our purpose in this series is to bring to you expert insights on compelling topics in a condensed half-hour format, so we hope you enjoy. We're excited to have Caitlin Reiche of Buoy Health and Jonathan Sherman of Synovapro join us here today. And they will be talking about why digital navigation matters for better healthcare. I'm Jen Sato, and I'm a Health Tech Build board member. And before we start, I wanted to take a moment to highlight what Health Tech Build is about. We're a mission-driven nonprofit focused on accelerating digital technology within healthcare and life sciences. We've held many events on numerous topics, and we've been fortunate to have many leading organizations participate. If you think you might be interested in partnering with us, we would love to hear from you. So reach out to us directly on our website, healthtechbuild.com. I'd like to thank our sponsor, MediCuity, and also welcome our speakers, Caitlin and Jonathan. Caitlin is COO of Buoy Health, a healthcare navigation company, where she's led the company's five-fold growth to almost 100 employees by the end of 2020. Prior to Buoy, Caitlin led product strategy and analytics for population health and patient engagement at Athena Health. Most recently, she was head of strategy at Patient Pop. Caitlin holds an MS in Health Policy and Management from Harvard's School of Public Health and a BA from Middlebury College. Welcome, Caitlin. Jonathan Sherman will be moderating today. Jonathan is a principal at Synovapro, a product innovation advisory firm focused on digital health, healthcare information technology, and technology-enabled healthcare service companies. He is a product leader with multiple successful exits, including Ability Networks, acquired for $1.2 billion, and Frisia with a market cap of over $3 billion. He has a strong track record of accelerating growth of transformational healthcare companies, and he holds his MBA from Harvard Business School. Thank you both again for joining us. We're excited to listen to the discussion. And with that, I will go ahead and turn it over to you, Jonathan.
Thanks so much, Jen, and welcome, Caitlin.
Thank you.
So I think you both know that just a few years after I graduated from Harvard Business School, my first wife died of cancer, and we had a really difficult time navigating the healthcare system. There were a lot of struggles, a lot of challenges, a lot went wrong. And therefore, I'm very passionate about transforming healthcare in general and passionate about today's topic. So really excited to have a conversation with you, Caitlin. How about you briefly share some insight about yourself?
Yeah, thank you. And thanks for sharing that story, Jonathan. This is, why I'm in healthcare tech. I think everyone has a story about healthcare navigation or how to make the healthcare system better or why it's so important. Healthcare is very personal and very relatable, obviously. I have worked in healthcare tech my entire career. I think specifically I joined Buoy because as a mother of three young children, navigating the healthcare system can be incredibly challenging and increasingly important. And I remember one time my daughter had really hurt her elbow, and we thought we needed to take her to the hospital, and she was 2 at the time. And I actually buoyed it. I buoyed her symptoms and what was going on. And they said, we think your daughter has what's called nursemaid's elbow. And again, this is AI. This is what Buoy does. It's an AI-based chatbot that helps people understand their symptoms and navigate them to the best point in care. But that's what the AI told me. And I thought, I've never heard of this. Is that real? And they said, you don't need to go, Buoy said, you don't need to go to the hospital, go to an urgent care or her primary care physician. And sure enough, that's what we did. And that's exactly what it was. It was nursemaid's elbow. It was very common, and they popped it back into place. And she was fine. And I thought, wow, this system actually saved us so much time, so much money, saved the healthcare system money, and saved us a lot of anxiety and worry. And so I just knew I had to join Buoy at that time. And actually, just now, I'm not in my normal work from home office. I am in Boston with my parents, as my dad has his own healthcare navigation journey with a brain bleed, and he's in the hospital at Beth Israel as we speak. So we're so lucky, I feel lucky often to live in such a wonderful place with wonderful healthcare. But even with all the resources that we have here, his journey has been really challenging, just figuring out what's going on and what to do about it, and how quickly to do something. So anyway, I think we all have a story here, and I'm really happy to be able to work in this field and to help people better understand their symptoms and figure out what to do about it.
Thanks for sharing that.
Yeah.
I have one little girl who's 5 years old, so you're having 3.
Yeah, you're in it too.
I'm in it too, but 3 is a bit
so fun
for me. Okay, Caitlin. So how about we start with just level setting and giving people a definition of what a navigation platform is and what it does.
Sure. Great question. I think we use this term a lot. So I think it's helpful to level set. At Buoy, certainly, we think about healthcare navigation as providing people with relevant, actionable guidance when they have a healthcare concern. So helping them understand what's going on and what to do about it, and where in the healthcare ecosystem to go to address their concerns. Or maybe, they just need to stay at home, watch and wait, or do some self-care at home. So that's how we think about healthcare navigation. And we also think quite a bit about how this can be done and where it can be done effectively. So healthcare navigation can be done through an employer, helping employees understand their covered benefits, through a health plan, helping members understand where to go, what's in network, what's out of network, or just for the a consumer, everyday consumer, kind of on the web searching symptoms and understanding what to do about their symptoms. And in order to do it well, we really think it's important to build trust with the user. So show empathy and understanding with what's going on. They're not alone in their journey, to do this in a really personalized way. So healthcare is not one size fits all. It's not even one size fits many. And so navigation really needs to be personal. And then making sure that a user or an individual is presented with choice. So there isn't always one solution. There's often never just one solution. And it's really about finding that balance of, how to present people with enough choice that they feel they have some autonomy and independence in this decision, but not so much choice that they still feel overwhelmed by the system and where to go.
Thanks. Maybe you've answered this next question in your answer of the first one, but maybe you just share with the audience why we need navigation platforms.
Yeah, I think I've spent a lot of time, in my career thinking about the patient experience, and oftentimes thinking about the patient experience from the perspective of a patient once a patient is actually in the healthcare system. So how do you engage with the patient? How do you pull them back in when necessary? But what really, appealed to me about Buoy and what's so important about navigation platforms as I think about them in this situation is how to help people before they even enter the healthcare system and decide at what point to enter, where, when, how soon. So this, I think, is actually more important than ever right now. Thank goodness, through the course of the pandemic, there was a realization that digital health and telemedicine is necessary. There's a high demand for it, and as a result, we saw I think something like $15 billion poured into digital health and telemed solutions in 2021, which is just a wild number. but that really resulted in so many new solutions, so many new telemed offerings, these sort of niche specialty-based telemedicine companies popping up all over the place. In fact, I was at the HLTH conference a few weeks ago, and you just looked around and there were hundreds of these sort of specialty solutions, which is so exciting in so many ways, because it means you've got companies that are really addressing, talk about personalized, they're addressing super specific healthcare problems. And that's sort of what we describe as the long tail of healthcare, and doing it in a very personalized, very specific way. But it also means that we now have hundreds of solutions out there for people, individuals to navigate, or, in the situation, what Buoy helps with is employers to navigate in terms of picking what benefits and what solutions to offer their employees. And so navigation has really become more important than ever in helping people understand which of those sort of myriad solutions are appropriate for them at the moment in time that they're in, and how to sort of navigate to those solutions and pick which one and how to sort of get into them. So we hear again from employers, how to, Buoy, can you help us figure out which of these solutions to offer to our employees? And we hear from users, help me understand which of these solutions is right for me. So I think, we want to preserve this, because again, we see this is so exciting that so many of these companies are popping up, but in order, I think if we don't do this navigation effectively, what we could end up seeing, the sort of scary alternative from my perspective, is we could end up seeing more and more consolidation, which is what we saw happening in sort of brick and mortar healthcare. But what we don't want to see is that happening in digital health, which is companies sort of buying up each other and creating these behemoth companies that end up becoming their own sort of walled gardens, and actually to the detriment of that sort of long tail of healthcare. So all why sort of navigation and doing navigation really effectively is super important right now. And we're excited about it at Buoy.
So as opposed to the consolidation, do you see the navigation platforms as connecting all of these point solutions and unifying them in somewhat of a seamless way across the patient journey?
Absolutely. I mean, that's a really important role for a navigator to play. Ensuring that, so, a couple examples, really interesting company that we just partner with at Buoy called Paloma Health. They treat hypothyroidism, very specific, one condition. How do people find that? It's a telemed vendor. They are very focused on this single condition. And so really helping users who are coming to Buoy, not understanding what they have, figure out that this may be a condition that they're dealing with, and then help point them in that right direction and connect them with this company. But then, so I think connecting users with these individual companies, but then connecting companies across each other. So, we spoke to a company that deals with alcohol use disorder and helps people address alcohol use disorder. But oftentimes, what this company said to us is oftentimes sleep insomnia is a symptom or an outcome of alcohol use disorder. So, can you help us actually connect our users with a company that addresses sleep concerns? And so, and there are, a few really great companies popping up in the sleep area right now. So I think it's not only navigating users to these individual sort of digital point solutions, but also navigating them kind of across these solutions and connecting these solutions with each other, when a bundle of offerings could actually be really effective in treating and thinking about a user more holistically. We want to make sure that we don't end up creating this really sort of disparate, disconnected healthcare system through all of these digital health and telemed companies, but play a role in, connecting users to them and then connecting them to each other.
It seems when you think about this, I'm uncertain as to what the boundaries are in terms of when you're when a patient is working or interacting with one of these platforms, when they leave it, when they come back to it. So and what's the breadth of it? So is it that a patient presents with with a symptom. There's somewhat of a diagnosis. They go into treatment, then they're not interacting with a navigation platform. Then they come back out when something else is different, if they don't have a clinician? Or is it something that, I don't know, your vision, where they're interacting with a navigation platform throughout their patient journey? And it entails more than, perhaps not yet for Buoy, but entails more than just, I guess it could include facilitating administrative hassles or financial hassles associated with healthcare.
Yeah, great questions. And I think the boundaries, Buoy is still navigating the boundaries of a navigation platform, and sort of we're always trying to think about what the next best thing we can offer to users and suppliers and these companies is. But one thing that I think is really important is this sort of constant re-engagement of users. So we, use something called sort of follow-up and engagement to make sure that we're, first of all, engaging with people at the right time and connecting them with care at the right moment in their journey. So if you think about what Buoy does specifically, people come to us before they've entered the healthcare system. They may be experiencing a symptom for the first time. And so we know that at that moment, they may not be ready to engage with a healthcare provider or another digital health solution. But in 4 days, if they're still experiencing that solution, they may well be ready to engage. And so I think a really good navigator is not just sort of interacting with users at that one moment in time, but is actually reaching back out and making sure that they're taking the navigators are taking that initial information that was presented and reaching back out and when the user might be ready to engage with care. Our goal is to make sure that people actually have their issues resolved through Buoy. And so I think a good navigator can do that. And also, yes, I think the goal is to make sure that user is kind of coming back to Buoy the next time they have a healthcare issue or the next time they want to find a solution for whatever they're experiencing. So that's sort of the role we see Buoy playing in connecting users to these point solutions. You asked about payments too. There is certainly, one reason why it's so hard to be a healthcare navigator is because to do it well, you really need to think about that sort of three-sided marketplace. So engaging, obviously, the user or the person experiencing the symptoms or needing care, the company or vendor that might be supplying the solution that we spoke about, but then also the entity that's funding the care. So I think what we're seeing a lot of in the digital health landscape is a lot of cash pay solutions. So these digital health vendors putting themselves out there, acquiring D2C users, and only taking cash. And that certainly meets a need, but it meets a need for a very small percentage of the population who can afford to pay cash for services. That really should be, our perspective at Buoy is that most of this, if not all of this care, should be covered by your plan or your employer. And so we really believe strongly that to do navigation well, you also need to connect that payer and ensure that where appropriate or possible, that user is able to access care and have it subsidized or paid for through their plan or their employer. And that is not easy. It's no small task, but that is what we're working on at Buoy.
Maybe you could share, you've spoken about the employer, talk a little bit about who the buyer is for these navigation platforms. And given that there are a host of them out there and they seem somewhat different in how they're approaching the problem, how an employer is making a decision and selecting a platform.
Yeah, great question. So Buoy specifically sells to self-insured employers and then also plans. So, those are sort of our primary customers. Any entity that's responsible for the cost of care for their population, because historically, our historical value prop is to keep people out of high cost care settings when appropriate, and which ultimately saves the healthcare system money and saves that user a lot of time and anxiety, as we discussed. We actually, read some outside research that said that 80% of employers are seeking to buy a navigation solution in the next 12 months. And so you can see it's really a need. And a lot of this is because they're just inundated with these niche point solutions that are, vying for the attention of healthcare benefits buyers or HR benefits buyers. And what we hear from these HR benefits folks is we can't possibly sort through all of these solutions or contract with them independently. Buoy, can you kind of navigate us through this buying process and help us, and so that we can ultimately better serve our employees? So what they're really looking for is a solution that helps them, a navigation solution that helps them meet the needs of more of their employees. So, traditionally, I think a lot of, especially in sort of mid-sized companies, a lot of HR buyers end up thinking, and I ran HR for Buoy as well previously, and we would think, okay, well, what of these solutions is going to meet the needs of the majority of my employees? And that's what I'll spend my time engaging with and contracting with. But really, it's sort of, again, back to this idea of the long tail of healthcare and that no one size fits all. What would actually be more beneficial to employees and allow, that company to be more competitive from a benefits perspective is to offer 20, 30 of these point solutions to their employees and cover that for their employees, so that they're meeting the individual needs of more of their employees. So they're looking for a solution that can help them do that can assist them sort of streamline the contracting, billing process, and then help users and their employees better navigate. What we really think is important there is a lot of these companies, these vendors have 20 programs within their one. So you think of like a Maven for sort of family planning and parenting. They have multiple programs that they offer, which are all so exciting and interesting, but really relevant at different points in a user journey or an employee journey. So there's, again, back to the sort of not one size fits all. What's really important for navigators to be able to get specific on the program level and present the right program at the right time to a user. So Maven sort of parenting program, present that to an employee when they're just starting out being parents, but Maven sort of maternity program, presenting it to them when they're, at that initial point in pregnancy. So the point is to, a good navigator is going to be able to get specific down to the program level and really present the right program or right option at the right time to the user. And that's what employers are asking us for.
How are you finding, so there are so many solutions out there that employers would like you to help navigate for their employees and for the company. How are you seeing vendors welcome a navigator being this, I don't know if you call it a distribution channel. So how are vendors responding to this marketplace idea?
The response has been overwhelming, really positive. And that has been, a very exciting sort of opportunity for us. I think I've met with 85 vendors over the past month or so, and they're all sort of chomping at the bit for this to sort of gain access via Buoy to these employers, because to them, it saves them time and money and resources to better sort of engage with these employers. But it also, there's this sort of better together argument that they also understand if we're one of 30 companies that an employer partners with, and we're sending these utilization emails to employees, but we're sitting alongside 30 other offerings that are also sending these engagement emails and also sending flyers and pens to the employees, then it's sort of really dilutive and not effective in terms of actually getting employees to use them. So they really see Buoy as, just as an employer sees us as a great opportunity to present the right solution at the right time, they think of Buoy as a company that can help send them to sort of the most highly qualified leads and users who are really appropriate for their care.
Got it. Caitlin, I could speak to you for hours on this topic, but I know our fireside chat was only for 30 minutes. So hopefully we'll have another time to chat. Maybe as a quick wrap up, I'll ask you in a short amount of time to answer a difficult question, which is, how do you think healthcare will look in 10 years? And perhaps as you answer that question, you'll think about the impact that a navigation platform might shape that vision.
Gosh, I mean, I think we're sort of the digital health companies, the telemed companies are not going anywhere. So they're here to stay. And again, I really hope that we don't see a ton of consolidation. I hope these companies are able to remain independent and thrive and focus on meeting these the very specific needs of users, and that more and more of them pop up. I mean, we've got about 500 conditions on Buoy's sort of top conditions list, and that's that people come to Buoy, the 2 million users a month come to Buoy and present with. And they are all looking for really specific, personalized care. And I really hope that in 10 years, we see more and more of that being made available to users through, a navigation platform. I also think, if I think about like employers offering this to their employees or plans to their members, I think we'll see less like what I hope we see is that employers are offering a full marketplace to their employees, and they don't need to go contract with these one-off point solutions. And instead they trust a company like Buoy or a navigation company like Buoy to say, we're going to trust you to vet these companies that are joining your platform, and we'll offer the whole marketplace to our employees, and trust that you're presenting employees with the right option at the right time. So I think there's going to be hopefully more of that in the future, but I'm excited to see what happens.
Okay. Well, I want to thank you so much, Caitlin. Your expertise, your passion, all comes through in such knowledge of this space. And Jen and Health Tech Build, I want to thank you so much for this forum. And we look forward to many more really valuable conversations. Thanks so much, everybody. And we look forward to seeing you all sometime soon.
Thank you. Thank you, Jonathan. Thanks, everyone.
Bye-bye.
Bye.